Servus beieinander. Es geht weiter mit den Gesprächen über Corona. Heute gehen wir mal nicht ganz so weit weg wie zum Beispiel USA oder Australien, was wir ja schon hatten. Aber wir verlassen die Europäische Union, was mir in der Seele wehtut. Freue mich sehr, dass Rob heute für mich Zeit hat. Wir kennen uns seit 35 Jahren. Rob, where you live and what is your profession?
Guten Abend. It's great to connect with you, Akim. I am based in southwest London in England, and I'm a university lecturer and a trainer in business. And I'm happy to share with you the view from London today, or a view from the outskirts of London today.
Okay, yeah, but you're closer to Westminster than I have been for. I think more than 4 years now.
I guess so.
Yeah. So what we learn here about the situation in the UK is that the Prime Minister has suffered a very severe infection, that the Prince of Wales has suffered an infection, although it went quite mild, that the Queen and the Duke of Edinburgh stay isolated at Windsor Castle. But what is the situation of the common people?
The common people, I guess I might include myself as a common person, but we have suffered, of course, during a lockdown that's been going on now for 2 months. But I think we went into lockdown a bit later than a lot of other countries. And at the current rate, the United Kingdom has the highest level of deaths in Europe. Well over 30,000. And I think there's a link between going into lockdown and having the highest rate of deaths, because I think we were a bit slow. But in terms of people, I think people have generally coped with lockdown well, but that's because we didn't have such a strict lockdown as they did in Italy and in Spain and in France. We actually had something, like a bit of personal freedom. I think maybe in Germany it was the same, but, we could go out for exercise. We could go out for shopping ourselves, with certain controls. But the message was still stay at home and protect the NHS, the National Health Service. And I think in general, people have stuck to that for 2 months. It's obviously been very tough to have your prime minister struck down, and that was very sobering, and I think it kind of left us without a clear sense of leadership for weeks and weeks, because deputies have to step in, and the team was maybe not very strong. But I think even now that Boris Johnson is back, and thank God he came back to full health. He was in hospital, in the intensive care for a number of days, and he wasn't actually on a ventilator, but he came very close to that stage before he started to get better. So it was touch and go with our Prime Minister. But even now he's back, I'm still not sure whether we have very strong leadership. Because the directions as we come out are, of course, difficult. People are now very tired with the lockdown. They want to come out. They want to get back to work. They want to, just get back, keep calm and carry on, but then get back to working. And yet we've got some rather vague communications from the government. So certain.
Yeah. I may be wrong, but I think times in the United Kingdom have been complicated even before Corona. The country has left the European Union, is about to negotiate a deal with the EU about the future relationship. How present in the media is this thing? Because if there wasn't Corona, this would be a massive. This would have extremely massive influence on I think media coverage and stuff like that.
Mm. Akim, I don't know what you're talking about. What is it?
Okay, gotcha.
Well, I think the vast majority of people have forgotten about Brexit um, because of this, sort of very immediate crisis.
Mm,
But waiting in the wings of this crisis is another, political crisis, and that's the fact that we're supposed to be, well, we've technically left. We're in transition
mm,
to being outside of the EU, but there's no way that the British government can fulfill its commitments to negotiating everything that it needs to negotiate by the end of this year,
yeah,
because it's just impossible to do it. And yet they're still saying that they're not going to extend, but they have to. I think there's no possible way that we can do that. They will have to
mm,
extend the transition period, because otherwise it will be another disaster on top of everything else, because
okay.
we will go into, a very unfavorable position in terms of trade with our closest allies and neighbors, you know.
We will get closer to the United States of Mr. Trump.
Well, I guess we'd have no choice.
Mm,
So, yeah, but I don't think people here in the UK they voted in Boris Johnson because he had a clear message. Okay, get Brexit
mm,
sorted, because people were basically bored of that. They'd had enough of it. They just want the politicians to go through with it.
mm,
Brexit was a protest vote, and people don't really want to know all of the details about what's going on. They just want politicians to get on with it.
mm,
And Boris Johnson heard that and said he was going to get on with it, and he gave a much clearer message at that time than the opposition. So I think the opposition, the Labour Party, have changed their leader now, and they may have a clearer message from now on.
okay.
But it's all been, papered over. The
Mm.
all papered over.
Let's not no longer talk about Brexit because, of course, Corona is much more virulent.
Yeah.
You said you were allowed to leave the houses to do some shopping. What kind of shops were opened? Was it just grocery stores, food
Yes. Yes.
stores?
Yeah. Just food stores, and social distancing. So, there would be only a certain number of people allowed in the stores, and then queuing outside, and 2 meters
Mm,
distancing. So I think people have conformed to that very well. There's also been a tremendous feeling, I think, as in a lot of countries affected by this, of communities coming together.
mm,
And, the United Kingdom is a very individualistic country, just like Germany. And people do tend to like their privacy and their independence and so on. But we've seen a tremendous sort of community sense of, local schemes supporting vulnerable people. I myself sort of found a Facebook group, and it was a local area.
mm,
Dropped a note through the people in my street and the next few streets, and said, if you need any help, give me a call. And so I've been delivering groceries to
mm,
someone just around the corner, an elderly couple who can't get out. They have mobility problems, and I think that's been, not just here; it's everywhere. So,
mm.
I think that sense of community coming together has been wonderful. So that's certainly happened. But yes, in terms of which shops have been open, it's just grocery shops. Now, recently, in the last couple of weeks, the largest DIY store,
Do it
uh,
yourself, yeah.
do-it-yourself store, has opened, and that was a little bit, contentious. An argument, is it necessary for people to be painting their walls during lockdown? But then I think it's a reflection of how frustrated people are at being at home if they haven't got work,
Yeah.
of not having anything to do. So I think they have opened up those, again, social distancing. And
Mm,
so there are more shops opening, and they've also just encouraged smaller shops to open now.
mm.
But still, bars and restaurants are not open and will not be opening for at least a month or more, I think. And it's a big problem, of course, for many, many people
Mm.
working in that industry.
If you follow British paper, I've been following British papers for many, many years in my life. Not only when it came to football matches between our countries, which mostly was fun for me, to be honest. Um, but you couldn't help following articles, columns, stuff about the NHS, about the National Health Service, about your health system. And it's always been kind of under pressure, and the impression you got was that it became a very weak system. How did the hospitals, the doctors handle this situation?
I think when taking a step back and looking at the response, I don't think there's evidence now that the NHS was terminally weakened, but I don't think it's had the investment, and certainly the government did not produce what it should have done in the time frame that it had. And there's an interesting sort of link with Brexit, actually, that the British government didn't take up an opportunity to work with the European Union on supplies of PPE, of personal protective equipment for doctors and nurses. And has been a significant problem for us here. I think in many countries, of course, but in particular in the NHS, they have struggled with getting enough equipment and had to reuse equipment. And doctors and nurses and professionals in the health industry have been, I think, absolutely angry at the government for not doing more to support them. So historically, we haven't invested enough in the NHS, but I think it's still a system that works remarkably well and remarkably efficiently for the little investment that has gone into it.
Okay.
In general, it's a functioning healthcare system, but it's certainly has been stretched. Another interesting thing is our current Prime Minister likes big projects. So we had what was called the Project Nightingale, and it was to build a very large emergency hospital. I think they saw what they did in China, in Wuhan.
Yeah.
Built a hospital in 5 days. Well, we did that at the Excel Centre, which is a big exhibition centre in East London, and thousands of beds capacity, and it's just shut down. They didn't use it very much at all, because in fact we did manage to flatten the curve enough so that there was not that kind of thousands of extra beds that were needed. The system run by professional healthcare workers in their hospitals, they acted and reacted effectively enough to be able to deal with the number of the huge number of cases coming in with COVID-19, and they've soaked it up and they've managed to cope, I think. But of course, we are absolutely, like every culture, every country, we're sort of really keen to get out of this, but we also face the fact that it's going to be a long haul, and there are particular industries that are going to suffer tremendously: the aviation industry, the entertainment industry, hospitality and tourism and so on. And that's tough. And then, of course, what should we do about schools? It's such a dilemma,
The same as here. But so all schools are closed in the UK?
Yeah, but they remained open for key worker children. But what's interesting is that only 5 or 10% of the children who could be going to school are going to school. So the schools are open for children of key workers, but many of them have decided not to send their children to school because they maybe have one partner who can look after them and the other is working. But they also maybe prefer not to send their children to school because it's seen as problematic, and maybe they'll pass it on there and then bring it back into the house. So I think we're totally caught, just as I'm sure you see in Germany, between going back to school, sending the kids back to school, which may make a lot of sense because then parents can go to work, but at the same time, could that be problematic if the kids have this illness and they don't show any symptoms, but they can easily pass it on to other people. So it's very difficult to know what to do.
Okay. I hear this from parents here as well. Another country you're very profound of and know very much about it is Japan. Your wife is Japanese. What can you tell us about the situation there?
Well, here's where it gets interesting, in that for a long time during the last couple of months, we've been observing from London. We've been, as a family, we've been observing and talking with Japanese friends and seeing a very different experience the Japanese have had with coronavirus. To begin with, the Japanese did not have many cases. They are very, they have lots of links with China, but they were quite quick to, in certain measures, to close things down. For example, with travel. And that's a very interesting comparison with the UK, who've remained, fairly open in terms of travel from other countries, even from northern Italy, people traveling backwards and forwards.
Okay.
Well, Japan closed down and imposed quarantines pretty early. But then the mystifying thing was that they closed schools, but then there was, that depended to a certain extent on the local region, and the schools could decide whether they were going to remain open or closed. So there were certain things that they did which were quite quick responses. But on the other hand, they didn't close down entertainment. They've kept restaurants open until fairly recently, and they did not have such a large increase in cases as we've had in Europe. And it's mystifying, but then you think of underlying culture. In Japan, people live in very crowded cities, but maybe because of that, they're used to practicing kind of social distancing as a part of their culture. The
Okay.
Japanese like to bow, and they don't like to stay very close. They will keep distance from other people as part of their culture. So, I feel like they didn't have to learn how to do that. They do it naturally. And the second thing is masks. Now, masks, if you look at the cultures in the East Asia, South Korea, of course, China, Taiwan in particular, and Singapore, they're cultures where mask wearing is part of everyday life. People do that anyway. If you have a cold, then you wear a mask when you go into your office so that you don't spread your germs to other people. So they understand it. Whereas masks in the West have not been part of culture. They are now, but they just were never that part of culture. And for us, the associations with masks were not hygiene and keeping people protected from you. Masks for us are things like radiation. It's Chernobyl. If someone's wearing a mask, it's because there's a radiation leak somewhere and you're trying to protect yourself. It's protecting yourself from others. So completely different associations with this idea of mask wearing. And so I think that meant that the first wave of coronavirus in Japan was much less pronounced than it has been in countries like Italy, Spain, France, and the UK. Of course, Germany has coped very well with it for different reasons, I think, in sense of controlling and checking, and it's been much better than a lot of other European countries.
I think what sometimes is Germany is sometimes mocked for people being so disciplined, listening to government and stuff like that. But I think in these days it helped us really.
Absolutely. But isn't it fascinating how culture shows through in what's going on, and the formal ways of dealing with this, and also the informal responses of people, that the attention to detail of in general in Germany has helped people to stick to rules and keep the level of the infection quite low, and then fast action and following it. But of course, we're all still facing the problems. And it's interesting now in Japan and Singapore and even in Korea over the last couple of days, they're having second waves coming through, which are not as bad as they are here, but they are, I think in Japan, the feeling is that they have now gone into more of a state of emergency. Their business is very much suppressed. Entertainment is very much suppressed, but people were socializing and going out and almost being a bit too complacent because they didn't have such a big first wave. And they said, oh, we're Japanese, we can cope with this. We're better than everyone else. But no, they're still at danger of a second spread, a second wave of infection. And it is growing more in Japan. I think they'll control it, but they're not immune, and nowhere is immune. So it's been fascinating to see it play out. But I think mask wearing and then, timely sort of action, that in general has helped Japan to deal with it a bit better.
Very fascinating. One question I'm asking, each one of my interview partners at the end of our conversations.
Mm.
When it all will be over, what's the thing you're looking forward to mostly?
Hugs with random people. No, I don't usually go around hugging random people, but just, be able to stand and not worry, I think. And that's the thing, isn't it? Just the close physical contact. And of course, close family. I want to go and give my father, who's 78, a big hug, but I can't. And that's the most frustrating thing that we all feel, I think.
Absolutely.
Yeah. And I guess the last thing would be to walk into a pub and sit down and have a pint. But I don't know how soon we're going to be able to do that.
Well, it might take some time.
Yeah. It's tough, isn't it?
For me, it's two things. On the other side, on one hand, of course, it's the pub and having the beer, for example, in a football stadium.
Yeah.
Which I absolutely miss.
Yeah.
Rob, as always, it's big pleasure talking to you.
Likewise, it's been wonderful. Great to connect.
Absolutely. Just stay healthy. Say hello to all your family I know.
Yep, I will do, and to you too. And stay safe and stay sane.
I will. Pass auf dich auf.
Excellent. Great to see you, Achim. You take care.
It's always a pleasure. See you.
Yeah. Mach's gut. Okay.
Du auch.